Passing blood in your urine can be really frightening. Most of the time it's not a worrying condition, but in a few circumstances it's a sign of something serious. Hi, I'm Dr. Sinan, the GP, your source on all things health related for you and your family. Blood in the urine is a surprisingly common symptom. I probably see it every day in clinic. It's almost always due to a problem with the bladder, the kidneys, or the tube that links them to each other and the outside world. For women, it can sometimes be difficult to know exactly where the blood is coming from, such as blood from the vagina due to menstruation or another cause. The main causes for blood in the urine are urinary tract infections. This is by far the commonest cause and is much more common in women. It happens because of inflammation in the bladder due to an infection. It's often associated with other symptoms such as pain on peeing and peeing much more than usual. The inflammation causes blood vessels in the bladder to rupture, causing small amounts of blood in the urine. This can also be caused by an enlarged prostate in middle-aged or older men. The prostate compresses the urine tubes and causes infections with associated blood in the urine. Check out my video on urine infections for more info. Kidney infections are another common cause. These are often secondary to bladder infections and are more severe and are usually associated with symptoms like fever, flank pain, and vomiting. Urethritis. This is inflammation of the tube passing urine from the bladder to the outside world. It's usually caused by STIs, sexually transmitted infections, and it's associated with other symptoms often, such as discomfort when peeing. Commonly, there may not be any other symptoms. Kidney stones also cause blood in the urine. They're small crystals that form from minerals in the urine. They often travel down the urinary system from the kidney to the bladder and then the urethra and cause friction and rubbing, resulting in bleeding and often excruciating pain. Tumours in the bladder or kidney can also cause blood in the urine. The commonest and often the first sign of bladder and kidney cancer is blood in the urine, usually without any other obvious symptoms. Remember though, this is a relatively rare cause of blood in the urine, and the vast majority of people with blood in their urine do not have cancer. Like all cancers, the earlier they're spotted and treated, the better the outlook. So it's really important to get any unexplained blood in the urine checked out so we're clear with exactly what the cause is. Kidney inflammation is another cause. Various kidney diseases cause the kidneys to become inflamed, resulting in blood in the urine. This is called glomerulonephritis, and it's often associated with tiredness and swelling around the eyes and legs. This is the commonest cause of blood in the urine in kids and young adults. Bleeding disorders too. If you bleed easily, you may sometimes notice blood in your urine. This can happen in the case of taking a medication that thins the blood, such as an anticoagulant like warfarin, or due to a disease that does the same thing, such as haemophilia. There are some other rarer conditions that can cause blood in the urine too, and even an injury can cause bleeding in the urine, such as trauma to the kidneys or having a catheter in. Even eating too much beetroot and taking some medications can make your urine go red. So what do you do if you notice urine in your blood? Well, for the commonest cause, a urine infection, many women will know what it is as they've had it before, and if it doesn't get better by itself in a few days, they usually reach out for antibiotic treatment, which often does the trick in a few days. In other circumstances, when you don't know what's going on or have other symptoms, it will always be sensible to get checked out with your GP. Blood in the urine is a common problem, and we can usually figure out the cause pretty quickly with a detailed history, including your occupation and medication history. Blood pressure is useful too. The kidneys are quite heavily involved in the regulation of your blood pressure, and a urine sample that can be analysed in the practice and sent to the lab for further testing if need be. The discussion so far has focused on blood in the urine that we can see with the naked eye when we pee. Often though, when we analyse people's urine in clinic with a urine dipstick, we find small amounts of blood that are not visible to the naked eye. This is also an important sign. This dipstick analysis hints to the cause and helps differentiate infections versus non-infected causes of blood in the urine almost immediately. You may need further tests too if you've noticed blood in the urine, such as a blood test to assess your kidney function, X-ray scans, and maybe a sexual health screen. If you have painless blood in the urine with no obvious cause, you will likely be referred for a camera test of the bladder called a cystoscopy. This allows us to look directly at most of the tubes and organs that make up the urinary tract to check for any obvious causes of inflammation and bleeding. You can find out more about cystoscopies in the description below. Depending on the actual cause, specific treatment will be provided. Some causes are relatively straightforward to treat with antibiotics such as urine, kidney and urethral infections. Some may need other medications such as pain relief for kidney stones or steroids for kidney disease, and some may even need surgery. The take-home message here is do not ignore any blood in your urine and get checked out ASAP. Thank you so much for watching. Till next time, stay healthy.